Meet Billy. Billy, just like you, is a fresh graduate from out of the confines of his medical school. As with most graduates, he has many questions on his mind, such as whether or not to take residency or what specialization to take. Having questions like these and many more are but normal for young doctors like Billy. Haven't made up your mind? Don't worry. Thankfully, there's a calling for folks like you. According to recent statistics from the World Health Organization, lifestyle diseases such as coronary artery disease and diabetes are on the rise, and the need for specialized healthcare in geriatric populations will become a fearsome opponent in years to come. Daunting, but fear not, for there are those out there who heed the call. Enter the internist, fearless men and women of virtue who strive towards holistic care for each of their patients, viewing clinical problems as a whole, like cunning detectives in hot pursuit of the suspect. Keep up the good work. Seen here, an internist meets with his patient and reviews the case, from head to toe, a complete physical examination, with diligence and care, compassion and competence, not one detail missed. But most of the work can be seen here, thinking, and rethinking things through to come up with a diagnosis. A definite challenge to all, but a delight once completed. But there is no greater reward for the internist than to see their patients get well. Indeed, the call of the internist is a gargantuan one, but it takes men and women of substance to get the job done. So Billy, do you have what it takes? Now that's the spirit. Internal medicine. We need you.
I am.
From 2005 internal medicine batch. Kami yung first batch na walang nag-quit sa internal medicine. If you really want to be in internal medicine, you really have a passion for it kasi toxic siya. Lahat ng referrals sa'yo. Having my residency here, it really taught me not only to be a good physician, but also how to have a interpersonal relationship with the patient and also sa mga colleagues at mga consultants. Actually, nakasurvive ako dito because also of the support group from my colleagues, from my friends. No? Important din that you have a good working relationship with your batchmates. Andyan yung mga batchmate ko to support me. Family kami dito eh. Napansin ko yun when I graduated na yung mga consultant ko before, ngayong magkaka-colleague na kami, parang we're just friends, no? So, maganda rin to develop yung really good relationship mo with them. They would call you as culture bearer kasi they would really know kung if you train outside, kung galing ka sa medical city or hindi. Kasi, cool under pressure. You know how to handle it. With fashion pa yun, fashion. I am.
Good. The best way to survive training in medical is to be honest. If you haven't seen the results or if you don't know what to do, you should be honest and tell your attending so that he will help you learn, or you can study at the same time. So if you can learn at the same time. You should also remember to follow all the laboratories that you have ordered. For example, or the chest X-ray or a CT scan. Before endorsements in the morning, all the things should have been followed up already so that the proper action or the proper treatment can be given to the patient. Of course, the treatment should be coordinated with the attending. I am.